My symptoms were a small ulcer in the cheek, which a little bit irritable. Decided to get some mouthwash, Cordyceil, and it went after a week of treatment. And 2 weeks later it came back with a vengeance, very big and irritable. And then my visit to the doctor, and consequently to the hospital to get diagnosed, which I got diagnosed with T3 mouth cancer after having head and neck x-rays and biopsies. Then an operation was taking place, discussed with the multidiscipline team what they were going to do, how long the operation was going to be. Once mentioned that I had cancer, the shock of knowing that I had cancer and then having to get it right in my own head before I could tell any members of the family. That was 7 days of processing it, so that I knew myself that I was okay with it before telling the members of the family and explaining to them what's going to happen and how supportive they've got to be, and I'm going to be okay, and we'll just continue with what we're doing until the time when the operation starts and my treatment starts. I was at the surgery treatment, and I had chemotherapy, radiotherapy, which was 6 weeks of radiotherapy. I think it's about 80 hours of chemotherapy or more, I'm not quite sure. Through the chemotherapy, treatment was pretty good. Having to make a face mask for me so that they could keep me pinned to the actual table so that I wouldn't move my head, so that they could direct the radiotherapy at the spot where it needed to be directed to, which they did a cracking job on that. Having had the operation, which was a fairly lengthy one, skin grafts from my wrist were then put into a flap into my cheek. They decided to make an incision across my neckline, following my ear, and then removing the face, literally lifting it up and taking the cancer out of there, at the same time removing my bottom teeth, again inserting the flap back into it, taking skin grafts off my stomach to replace the flap which I took off my wrist. And that was it then. Then it was a matter of getting back into the ward and seeing how things were going. Again, couldn't eat anything. Had a peg put into my chest whereby I used forceps and drinks and things like that to build my energy up. Thank God that the energy came back pretty quickly, and I survived the operation. I've only got one saliva gland, so when I talk too much I have to shut up because my mouth dries up. If I have anything which is tart or anything sugary, it affects my tongue. My tongue starts to swell, and I get a bit of lip swelling on my left hand side. And I've noticed over the years that because I've no feeling on my left side of the face, there's no muscle in there, my jawline seems to be moving over towards the right, as the right of my face is doing all the hard work. And that is starting to affect the speech a little bit, so I have to be very careful when I'm talking to make sure that I'm saying the words properly, because people sometimes don't understand what I'm saying. And that's the only downside, I suppose you could call it a downside. Well, it affected my children, because I think I was one of the worst patients going. I threw Dolly out of pram quite a lot because I like my food, and my wife and my daughter-in-law are very, very good cooks, and every time they're making something, I got the aroma of ginger or spices or anything like that came through the door. I was like, what are you doing? What are you trying to do to me? You're trying to upset me, which I say, I can't eat, so why are you making all these things? And my wife pointed out it's not just you in the household, other people have got to eat, your grandchildren have got to eat. Then I realised, and stop being selfish, calm down, carry on with your treatment, make the most of your 40 sips and your peg, and just get better. And that's what my aim was, and doing that, getting better, keep on with the 40 sips, get my energy built up, taking my medication, and enjoy the food afterwards. And then from that day on, it was just being positive about everything, taking life each day as it came, but with a positive attitude. Positive thought was having my grandchildren always around me, giving me that energy. Come on, Grandad, do this, do that. And when I first was diagnosed with cancer, I thought, well, it's T3, and it's going to be, am I going to survive this? What's going to happen? Will they get the cancer? Will they get it all? And I'm thinking to myself, well, will I be around to see my grandson, go to university? Will I be around to see them graduate? And God willing, through the surgery and all the nursing capabilities of the hospitals, yeah, I saw my eldest son graduate with a first in criminology and forensic science. My second grandson a 2-1 in economics and politics. And yeah, I'm a very happy granddad at the moment to see these things happening. On top of that, my eldest grandson got married, and I was able to be at his wedding, which was another fantastic bonus for me. And now the second bonus is I've got a great granddaughter on the way. So yeah, it's been a good journey. From 2010 until now, I'm a very happy person. With all the help that Macmillan gave me, I said to myself, it's payback time. I contacted Macmillan, became a volunteer on the Mobile Information Services bus, where we went around cities explaining people about different types of cancer. I spoke to quite a lot of people saying, look, I've had the cancer, I'm here to tell you about it, here to tell you to stay positive once you're diagnosed with it. Don't go doom and gloomy, just get it into your head that it's going to be okay, and you'll beat it, because cancer will feed off your negativity. So you stay positive, and that's it. And then COVID happened in 2022. Then the Mobile Information Services obviously stopped because we couldn't go around seeing people. At the moment now, I'm doing a bit of voluntary work through the Sikh Association and things like that. So getting back in with Macmillan to do voluntary with them, trying to do something on their voices. So just continue in the right vein, in a positive situation, a positive way of helping people. Nobody knows about oral cancer, they don't realise that it's there. Information I started picking up and started looking for, I heard about this from Macmillan, and even when I was at the hospital looking at information, but what the Oral Foundation's doing now, the Cancer Foundation, is doing a fantastic job. They're making more people aware of what's going on. So, once again, I'll say it again, don't use your dentist just for your toothache. Use your dentist for everything. Get a check-up on your teeth, make sure you see the hygienist, because these are the people that can help you to spot your mouth cancer. It's not all about smoking, drinking, or Asian people have this palm thing. It can happen to anybody, not because you're doing these things, it can just happen. So going to your dentist will help you tremendously.